Hi, this is Dr. Fodero. I'm a board-certified plastic surgeon, and today we're going to be talking about rhinoplasty. This is a young woman who presented to my office with a few complaints. Her primary complaint is the bump in the bridge of the nose and the fact that when she smiles, the nose tends to droop. So here she is from the front, and even from the frontal view, you can see the bump in the nose, and you can see that the tip is more dependent or lower than is ideal. Here she is on the oblique view. Once again, you can see the bump in the nose, and you can see how the tip is somewhat dependent. And from the side, this is her primary complaint, is that the bridge has a bump, and the tip of the nose is droopy, especially when she smiles. And here's the other side. So the goal of the surgery is to make a straight profile, to get rid of the bump, to refine the tip, and to gently elevate the tip. And here she is after the surgery, and even from the front, you can see that the bump is gone. The tip has a better shape. The tip has been elevated. It is not coming down over the lip as much. And from the oblique view, you can see a very nice, pretty, smooth profile, a pretty tip, and you can see that the tip is now in a better position with relation to the lip itself. And here she is from the side, and this is the picture that she didn't like before, but you can see that the bridge is perfectly straight. The tip blends with the bridge of the nose, and the tip has now been elevated, and it has a proper relationship with the lip. So if we look at her pre-op and post-op pictures next to each other, on the frontal view you can see that she has a bump, which is fairly conspicuous. You can see that the tip is broad and tends to droop. When we look at this oblique view, once again, you can see the bump in the nose. You can see that the tip sags and comes in over the lip. And you can see on the postoperative views that the profile is now straight and the tip has been repositioned. And then most obviously, when we look at her from the side, she has a very nice profile now. Before she had a bump, and now she has a very straight profile. You can see that the tip has been brought up so that it has a better overall sense and is balanced with the bridge. And she's very happy with this result.